Hi, I'm Kelly Vaughn, and this is Inside Indy. We're going to start today's show off with a question. Have we criminalized mental illness in our community? In other words, is a person who's committed a crime just a bad person or having a bad day? Well, we have a panel of experts here from Marion County in the studio with us today. We're doing things a little bit differently for this week's show. Joining us are, first of all, Officer Sherron Franklin of IMPD. Welcome to Inside Indy.
Thank you, Kelly, and thank you for having me here today.
We also have Julie Zemfrick, who is a registered nurse, Associate Vice President at Eskenazi Midtown Community Mental Health Center, right?
Yes.
Welcome to the show. Pastor James Jackson of Fervent Prayer Church here in Indy.
Good to be here, thanks.
Thank you for coming. We also have Kimball Richardson, who's a regular on our shows here. He's a licensed counselor and manager of business development for community behavioral health. Welcome, Kimball.
Thank you.
And Dr. Allison Bordeaux, who is a psychologist and director of outpatient clinics for Community Health Network.
Yes, thank you for having me.
Thank you all for coming. Man, this is going to be exciting, and just having this panel of experts here. And you have been a part of a panel that's a part of a forum that you've been doing, right, in our community?
Yes.
And we're going to have Officer Sherron Franklin tell us about the forums you've been holding.
Thank you, Kelly. The forums that we had were held basically because the Director of Public Safety had identified focus areas in the city that had high crime, or areas that had a large number of emergency runs there. But what they found in those emergency runs, that they were not necessarily runs where there was a police run where it was like an actual crime, but it was a person that was suffering from some type of mental health issue, and they needed to get some type of mental health help. And so once they started to identify that, they found that a lot of people didn't want to talk about mental health, nor did they know about mental health. So they thought, well, we have to get the information to the citizens, so how can we do that? So the idea was birthed through Commander Waters, who's now the Assistant Chief, James Waters, and Dr. Allison Bordeaux, who had done similar forums in Shelbyville, Indiana. So, but they wanted to incorporate the faith-based entity into this type of forum. So what I did was went to several ministers within our community, faith-based ministers like Pastor Jackson, Pastor Sample, Pastor Moore, and Pastor Covington, to see if we could host those forums in their churches so that the information could get out to the citizens. And what we did was we partnered with Eskenazi Midtown Mental Health and also Community Health, Behavioral Health, so that we would have the experts giving the information to the citizens.
Okay. So what information are you trying to get out to the citizens, and what information went forward in those forums? And whoever wants to chime in first is fine with me. What were your messages? Dr. Bordeaux?
Yeah, sure, I'll chime in. When I met up with Assistant Chief Waters, we really just kind of had a casual discussion about how can we really get the message out there to really take a look at breaking down the barriers and overcoming stigma. I would really say that the biggest message and the point of these forums is really to get the education and to engage the community about mental health conditions and overcoming that. It's so stigmatized, and how can we overcome that? And we just happened to have a casual conversation that led into the planning of these forums that we had, and it's so nice to have it actually come to fruition and have it develop. I had done something similar in Shelby County,
okay.
And I had partnered with Major Hospital at the time, and we had a fantastic turnout, and it really was to educate the community there in Shelby County, and so I thought, why not bring it here, and I'm so glad that we did.
Okay. What did you get out of the ones in Shelby County? And what have you found in terms of the challenges that people who are calling the police are having, and the police who come in to assist?
Mm-hmm. The one in Shelby County was a little bit different. We were talking a little bit about some crisis intervention.
Okay.
However, out of that, a lot of individuals that were there that received the information found out ways to get treatment. And so, because of that, they were able to take back information to their facilities or organizations or family members or partners, and we're able to seek out treatment. And again, just to really bring the community together, and how could the police department, how could major hospital in that specific area come together and collaborate in order to really help individuals that are suffering from mental illness. And so I think that's what we wanted to do here. In talking with Assistant Chief Waters, I think there have been a 200% increase in police runs due to mental health conditions. And, with the police department, they do receive crisis intervention training. But, they are not licensed mental health therapists or psychologists. And so really, getting the information out there and the education so that we can really kind of just get individuals treatment that really are needing the treatment instead of being inappropriately incarcerated.
I want to ask Officer Franklin, when you go out on a run like that, do you know what you don't know what you're about to run into, right? And how do you distinguish between whether this is a criminal situation or whether this is a mental health situation?
Well, Kelly, that's a good question, because you have to realize that each individual officer is different. And if we don't have crisis intervention training, we may not know what signs to look for. So then you probably go on personal experiences, and you look for, I guess, listen to the person's language. What are they saying? Are they repeating themselves? Does it sound like something that is probably a mental illness versus something that's criminal? So you don't know. And again, like I said, each officer is different in the situation. And most of the time, they are arrested when they probably do need to be helped. Now, we do have a procedure called immediate detention, where if they're saying something where the officer deemed that they're a harm to themselves or someone else, they can be immediate detention and taken to Eskenazi, where they'll be receive treatment or analyzed or evaluated. And so that's one of the tools that's in the toolbox for officers. So we do have a tool called immediate detention, but still that's based on determination of the officer on the scene.
Okay. This is directed to Julie Zenford, who is a nurse at Eskenazi Health, Midtown Community Health. So are you all, including community hospitals as well, are you partnering together? Is there a partnership? Because I know out in LA, they have done such a thing where the clinicians are teaming with police officers, but has that happened in Indianapolis? And I'll give the folks at community a chance to answer as well.
Absolutely. I think that was the idea, was to look at what we could do together and covering all sides of the city and being able to bring our messages into the community, into the faith-based community, where we could address people's real concerns about, first, what is mental illness? What does it look like? What do I do when I have a loved one that I don't know if they need help or not? What are the signs that they do need help? When does it cross that line? And also, a lot of people were very concerned about their children and what has happened to their children so far, and how is that going to affect them long term. And I think we were just beginning to have dialogues with people regarding what they could do and what they should watch for. Mm-hmm. So I think the idea was for community to do some more in the areas of the places that they serve, and for us to do some. So it kind of broke down east and west, and so we worked with churches to be in the faith-based community to try to get to a different group of people in a safe environment that was on their turf.
Kimball, you want to add to that as far as community's involvement?
Well, I just want to say thank you for bringing this to the public's attention. And we can't do this work without good partners. I just met Pastor Jackson today, but I can tell you that I get a sense from him he's a good man, and he could be a friend that I could call on, as well as I can call on any of these folks. We have to have those partnerships so that we can destigmatize mental illness, as Dr. Bordeaux said, and decriminalize it, which is the original question that you asked. So we've been very instrumental in wanting to be involved in all kind of police initiatives that's been going on. We're just really happy to be there at the table.
Okay. This is for Pastor Jackson of Fervent Prayer Church here in Indianapolis. Does the faith-based community see the benefits of the mental health collaborations? And how are you all involved as a congregation?
I always see a great benefit in all of our collaborating partners that we've been talking to, and I think it's been really strategic to have good people like what we have here to collaborate on the issue of mental health and making sure that people feel better about talking about mental health issues. We talk a lot about physical health, we talk a lot about spiritual health, we talk a lot about financial health, but that mental health, when we get there, a lot of times people don't want to talk about it, but they need a lot of help. In the church, in the faith base, we can help people, we can pray for them and get them what we call delivered mentally. But once they walk outside the door, a lot of people are faced with the same issues. And so we want to make sure that people have outlets, that not only can you get help at the church, but you can get help at some of the organizations that are represented here today.
Okay. When the police go out and they're on a run, and what kind of mental health issues are we seeing? How are people acting? How are they reacting? And we're going to take a break and think about that question when we come back. We'll address that and many more here on Inside Indy after this. We're back, and we have our panel of distinguished guests here who are helping me answer the question, have we criminalized mental illness in our community? And one of the questions that I was posing to the panel before we went on break was, first of all, who are the mentally ill when you're out making a run in the community? Officer Franklin, what are the symptoms? What do you see? What are the various things that happen when you get there? For some examples.
Well, Kelly, a couple of things I would like to add. First of all, this is just not conducive to our community. This is trending nationwide. I mean, you can go on the internet, look at news reports, and this is going on across our country. And the biggest problem that I've seen in reading, they were talking about the deinstitutionalization of mental health hospitals, and they thought closing those, the people would, take the medications, and they didn't. And so now they're finding that they're having to deal with this. There have been numerous studies and reports wrote about how the jails have become the new mental health institutions. And so now we're forced to deal with it. In our community, so our community is no different than any other community. So each officer's experience is going to be different. Because sometimes it may not be something long term. It may be something that just happened because a person can't deal with something that's happening in their life right at that moment, like the loss of a job, a spouse leaving them. Because suicides are not reported in the in the news. And IMPD itself has experienced a number of suicides recently. And so different things cause, people that seemingly don't have any issues to make a rash decision. And suicide is probably the biggest one, causing harm to themselves and others. The other thing is misdirected or misplaced anger, angry, violent outbursts where someone is normally a happy-go-lucky person and then something happened that they can't handle. Also what we're finding is people are feeling overwhelmed about burdens. I know on East District, I talked to a number of the young officers that are on the street, and they often mention about the number of runs they get where parents can't control their kids. So they're getting runs of parents versus child. And so that's causing stress not only to the child, but to the parent. And that's how we came about with the program, the Juvenile Initiative on East District, because we were getting a lot of overwhelmed parents. So we partnered with mental health agencies that said, okay, when you guys identify that particular parent, call us, we'll make an appointment to try to get them in and start getting some counseling for the parent and the child to try to rectify the situation.
Okay. You mentioned, did you want to add to that, Dr. Pedro?
The only thing I'd like to add, though, is how important it is for that early intervention. It really is important. About 50% of mental health conditions are about 75% by age 24. So the earlier that you can intervene and get treatment, the better the outcome and recovery.
Okay.
I think the other thing is that we were hoping with these forums was to help the community understand that the police are there for them, not just to come and arrest them, but to help them through some of these crises that they're having. And so that was our hope in coming together with the mental health community as well as the police department, was to say, call them before something happens so that they can come out. And we're beginning some initiatives to be more available from the mental health side as well as from the officers.
And do you mind if I chime in on that as well? Just to give you a real live example, Officer Franklin just emailed several of us on our panel just this morning and said, I have this situation, this person needs some resources, you know, give me some advice. And so that's how we can get these things done in real time, by working together more collaboratively. So
Before something happens.
exactly.
And that takes a lot of relationship building between the community and the police. You have a lot of people, particularly in the black community, that don't really trust police officers. And a lot of people, from their perspective, don't really see police officers as helping them with emotional or mental health issues. So the more we talk about the services that police officers can provide or be on the front end of as first responders, we're not here to arrest you, we're here to help you. And if helping that citizen means being able to recognize that there is a mental health issue, then that person can be directed to the right kind of help. But that takes the continuation of these kinds of talks and beyond the studio and the things that we've done in the community with Dr. Bordeaux and IMPD and others, just to keep it on the boil and to keep raising the awareness so people feel good about talking about it.
And that's why we wanted to do that in the church, in the faith-based community where people felt safe, and so that it was on their turf and not within a community mental health center where they have to come for help. So.
But oftentimes, the person who has the issue, are they able to receive that advice because of the stigma attached to it? And what are you seeing in that respect, that you identify an issue, you see a problem, but does that mean that the person who's having the issue is receptive, or how do you get a hold of that?
I think, you know, at the start, people are hesitant to really accept that help because most times people say, well, I'm not crazy. But that's not the issue, and that's how I think it's become stigmatized. As I understand it, at least 3 years ago, 30% of young black males who were coming back into society had mental health issues. At that time, when I looked at it, it was
You
30.
mean after being incarcerated?
Yes.
Oh, okay. That's probably even a low number, to be
So,
honest. Yeah.
right, and that was about 2-3 years ago.
Yeah.
So now here we are, and without treatment, that number is increasing. We have more children on medication. So we have a real serious problem that a lot of people don't want to talk about. You know, we all have in our lives and in our homes sometime. You invite someone over, but you don't want them to see the junk drawer. But you pull the junk drawer out, and okay, well, here's where the issue is. And I think the mental health issues or the behavioral issues is kind of our societal junk drawer that we need to pull out, and we need to deal with it. And so we can not only help the individuals, but when we help the individuals, we help the entire community.
I agree.
It's a great analogy.
You mentioned the issue of suicide earlier, and you had mentioned, Officer Franklin, that they're not reported in the news. And actually, as a news reporter coming up in radio, we were instructed not to report suicides. And I'm not sure why, other than the perception was that was their problem. And so I had a conversation with Chief Height once about suicides, and he was saying that, and I don't want to misquote him, but that suicide is really the same thing that's going on with the murders. It's just the person is doing it to themselves.
Right.
Do you find that to be the case?
Well, Kelly, I'm not the resident expert on that, so I really don't even know how to answer that question, other than probably they don't want, you don't want to bring embarrassment to the family. So that may be one of the reasons why. We live in an age where everyone's looking at Twitter, social media, the news, online, internet, and so things are not on the forefront of people's mind if they're not looking at those avenues. I think in reporting suicides, we could show that there is a number of people that need help, but then again, it may be an adverse reaction where people think that that's an avenue that they can take instead of dealing with their problems as well. But where it might help one family or one person, it may not help someone else. It may harm them or cause them to think that that's the route to go. So I really probably cannot answer that question.
Any other thoughts on whether the media should report or not report
I think
suicide?
there's a wide range of reasons why somebody commits suicide, so there's not going to be one answer for that, because people commit suicide because they have a significant, deep depression and they don't know any other way out. And I don't know what that's going to help to expose to the community, except for the fact that if you need help, there are people out there. That's what we're trying to get to. We're trying to get to before that time where we can say to people, there are other avenues. If you're hurting, there are ways to get help. And to the people around them, the supports that they have that see this person that's becoming in trouble because of either bullying or whatever you were alluding to that is maybe driving them to feel so badly about themselves, to say, get them to help, get somebody to talk to them. Start with the church, start with your physician, start with a mental health person, whoever you're comfortable starting with. Call the police, talk to a police officer in the community. There's all kinds of people available to help you, whatever you're more comfortable talking to.
We're almost out of time, so I have one more question here. Very quickly, do we have, I know we're having the forums, do we have a solution, a program that's in place now to address this issue, or some kind of partnership between the mental health clinician and the police officers, again, as they do in LA? Is this something that has been solidified yet, or is this something we're moving toward, or something that has to be done as far as the legislature or the city county council? Or
I think it's under construction in the Your Life Matters initiative under the present administration in Indianapolis. The Your Life Matters plan includes a massive collaborative effort to deal with the issue, and it will require all hands on deck, if you will, and it will require an enormous amount of resources, because for all the people that we know who have mental health or behavioral health issues, there are many thousands more that we don't know about. And so my hope and prayer is that we'll get to the point where there's so many resources for help that we can help everybody.
Okay, well, thank you all for coming in. Officer Sherron Franklin and Pastor James Jackson of Fervent Prayer Church, Julie Zempruk with the Eskenazi Health Midtown Community Health Center, and Kimball Richardson and Dr. Bordeaux, both of Community Behavioral Mental Health Network.
There you
Did I
go.
get the right? Thank you all for joining us
You're
on
welcome.
Inside Indy. We'll continue this discussion either here in the studio or even publicly, so stay tuned for future forums. I'm your host, Kelly Vaughn, here on Inside Indy. Thanks for joining us. We'll see you next time. Bye-bye.